Okay, good morning, everybody. Today is Saturday. It is April 6th. It's been a hot minute since I've talked to you all. I needed to take some time for myself off, so I took the last couple of weeks off. Bob is doing well. He is down to just speech therapy, and we'll get into why he's just down to speech therapy in a minute as we continue our stroke series. And I wanted to tell you or dive right into this. When you have a home healthcare team, depending on the patient's circumstances or how much they need, will determine how many visits you get. About 2 weeks ago, the nurse was only coming once a week, and things have kind of stabilized enough for my husband to where his doctor can take over most of the physical care. Now, my husband still needs speech therapy, and he still does need occupational and not so much physical, but occupational. And we'll get into that in a few minutes on why occupational only came twice and what to do if you have problems with your home health care team and what you can do about it. So let's dive right in. After Bob got home from the hospital, or when the patient gets home from the hospital, as I said in a previous video, which I will link as in the playlist to follow along the stroke care, your team will come to the house and they'll set up appointments and let you know when they're coming. Now, physical and occupational were kind of weird with in his case, and this is one thing you want to monitor and be with the patient when they get the evaluations, because if you see something that doesn't make sense or you have a question about, usually your home health care team will give you a packet which will have a phone number to their main line where they handle the appointments and stuff. Don't be afraid to use that. And I've unfortunately had to use that a few times in Bob's case with his stroke. The biggest problem was his physical therapy came out for 5 minutes, watched him walk, and said he didn't need physical therapy, which made no sense to me, even though my husband can physically walk. He can bathe, he can get dressed on his own with little to no difficulty. The problem still is he should have still gotten physical therapy, and he wasn't getting that point. And we'll get into why in a minute. The other thing was occupational. I had a lot of problems getting an occupational therapist in. Occupational therapy handles like movements and works with like hands and legs. Problem with occupational therapy in a home setting is a lot of times they don't have the full equipment that they do in an outpatient center. Now, the other problem is because there is only one outpatient physical therapist in our area, she handles multiple people, and it ended up being that she only was able to come twice in his case. And I'm gonna go out here because Bob's got the TV on. So she came out twice, but she was able, once she finally came out, and it took a lot. As a matter of fact, it took a doctor's appointment and my doctor actually screaming, and then the hospital where Bob had been admitted for the stroke, to say, she agreed with everything I was seeing with him and said he needs the reevaluation. Now, you can have the patient reevaluated, and it's a very good idea if the patient has had a major stroke to do that, if they're not getting the benefits that you feel that they should be getting. Now, insurance will play a lot into the game of the healthcare, but you can always call the person's insurance company and advocate for the patient with them. Now, usually in order to do that, you need to be a spouse or you need to have power of attorney. over their health care to be able to do that, and they will ask for proof of that. I was fortunate because, I explained the situation, and I happen to be the spouse of the husband, so I was able to do that. But advocating is a big, big, big deal with a stroke patient. Now, what happens once they start to discharge? So you've had your therapies, and the patient is progressing. Well, once the healthcare team feels that they've done all they can do in the home setting, they'll start to want to discharge, meaning that they won't need to come to the house anymore. Now, this can be a little bit overwhelming for you as a caregiver, because that means that the treatments that he's been getting in the house will stop. Now, if you have a good home health care team, and we've had wonderful, the nursing care that he's gotten has been phenomenal, as has the speech and even the occupation, even though the occupational therapist only came twice. But they were able to give exercises and a detailed sheet of what my husband should be doing. Now, speech is continuing, and I'm working on getting Bob into a rehab center where I can take him for physical, occupational, and speech therapy a couple of times a week. I'm still waiting to hear from them, but that's the goal for him. So, if they're getting ready to discharge and you don't have a long-term plan in place, it's always good to talk to the physicians as well as the healthcare team to see where you should progress next, whether it be starting outpatient therapy, where you take the patient to an outpatient building and they have the therapy that they need. Now, most insurances will cover that, but they'll only cover so many days. Like in my husband's case, I think he gets up to 60 visits in 1 calendar year, which is a lot. But if a person has had a big stroke and are unable to speak, talk, do any of that, you're going to go through those benefits very quickly the first year. So it's always a good idea to talk and to communicate with the health team to get a plan in place once discharge is planned. So, that being said, I'm going to stop today's video. I'm going to take probably Sunday, Monday off. Bob now only has speech, which comes Tuesdays and Thursdays. As he progresses, we'll do more of this. And then once he gets discharged and into the rehab center, I'll come back and we'll do rehab care of what to expect when a patient goes into rehab. We will be discussing food and stuff shortly. On what you should and shouldn't feed a post-stroke patient. And I'm going to pull this up so you can see me. And it's really not that big of a deal when you have to switch somebody that's had a stroke or even a heart attack. It's just tweaking their diet. Like, Bob was eating a lot of beef pre-stroke, and I've cut our beef out. Not completely, but I've cut it to maybe once a month, maybe twice a month now, where I'm substituting more turkey, chicken, and pork in his diet versus lamb and beef. And there are a lot of recipes that you can follow that are more healthier than having steak or greasy hamburgers every night of the week. And we'll dive into that as the series progresses. So anyway, you guys all have a great weekend. I'll see you on the next Cooking with Joel and the next stroke care update with Joel.